got stolen out of my car. My mobile phone's in my bag.
The itching is unbearable. I could literally throw myself off the balcony. I don't know what to do with myself.
Do you think you're having problems with your memory?
Forget kids' names.
Kids that you should know?
Well, my grandchildren.
OK, fair enough.
How long were you in prison for?
3 months. I've come out today.
No cocaine use?
3 months now.
3 months.
What is it that you're scared of? You just sit back over here. Bring baby with you. Oh, bless. Yeah, just... Oh.
Good morning, Vaginal surgery here to Diagnosing. How may I help you? Roma?
Are you stiff as a...
Yeah, I'm stiff as a... not that cardboard I ate this morning. Not this morning, yesterday. I opened a packet of cereal. You know the cardboard?
Oh, yeah?
Cut my finger, cut my wrist.
Oh, really? Bloody hell.
Cardboard, and it was so thin.
That's it. How are you anyway, darling?
Stiff. Stiff. You just had to do it there, didn't you?
I did.
You just had to.
Look at it coming out
Yeah, you
already.
see, I always do it right there on the bone bit. So I felt that one. Oh, did I? I hate
I
this.
woke you up anyway.
Oh, yeah. I'm definitely awake.
There we go, darling.
Yeah, so is there anything on there? I've been put in for a gastric band.
Oh, have you? Lucky you.
Yeah, Dr. Doodove, the old heart specialist here. What's his name? Nanda?
Oh, Dr. Nanda?
Yeah, he's put me in for it.
Oh, I'm going to go and ask for one of them.
He's not your doctor. But I was over the moon. I went home and cried.
That's really good, isn't it?
Wow. Because he knows I'm suffering so much. I mean, all right, I'm 62, but this is going on since 58. No, and I'm just getting worse. And I'm not moving about. Just can't do anything. And I'm 20 stone.
Really?
20 stone on the dot. Dead on, not a fraction over or under.
I've lost 5.5 stone. I went with Slimming World.
Okay, my mother did years ago.
Yeah.
So what did you weigh at your biggest?
The biggest I weighed was nearly 18 stone.
See, you did it all on your own?
Yeah.
That's hard, isn't it? My hard one is bread.
Yes, I don't eat bread. I don't eat bread and I don't eat cheese now because...
They're the two, aren't they? Bread mad. I look at is it a batten? You know, when they're crusty but soft. I look at the batten, I've got to take the end off with my teeth. Because you've got my own teeth, innit?
One good thing, you should have got your own teeth.
Because if they weren't my own teeth, they'd be sitting in the batten, wouldn't they, for my boy to have me go.
Right, I need to see you next week, darling.
OK.
OK, because it's gone a bit low. Let's concentrate on this. It's 1.8, OK?
Oh, it's gone low?
It's gone low. So I want you to take 9 tonight.
Yeah.
And then 10 all the rest of the week, OK?
Looks like I'm going back to what I was in the beginning.
Yeah.
Which was 10 straight away.
Which was 10 straight.
9, 10,
Yeah.
10. Yeah.
Right, 30th. What sort of time do you want, babe?
Same time, 11ish. Does me fine. It takes me like 3 hours to get out of the bed. OK.
Same time, same place.
Same place, same channel.
Yeah. You're right, babe.
I'll tell you what, if he knows that if this doesn't happen, I'll be scooting in here on me trolley. Thanks, darling.
See you later, bye.
You know, people are really nice to come here and you laugh and you smile at us. For a patient, it's much nicer to see a girl that smiles at her and is polite and makes you laugh.
Don't tell everybody that, because we've got a reputation to keep.
Come on. Keep smiling, girls. You're all lovely. Thank you now. Bye-bye.
How can I help?
This leg is swollen right up.
OK.
Compared, it's pressing on the jeans at the
OK,
moment.
take your jeans off. Let's have a look. When did that start?
Oh, I've had it for ages. I've got varicose veins in this leg.
Yeah.
All the muscles.
So over what period of time have you...
Oh, I've had this for a couple of years now.
So what... I mean, have you had to have a swelling come up?
Yeah.
And what's happened? What have we done previously?
Well, nothing really.
Just gone back down again?
Yeah. But it's just staying there now. It's just aching all of the time. I've hardly got any ankle bones showing or anything.
Have you ever had any scans or anything like that
No.
before? Any clots before?
Not as far as I know, no. I get a lot of cramp as well.
I mean, it's definitely swollen.
Yeah.
There's always this concern of clots. Do you smoke?
Yes.
There's always concerns of clots. And I just wonder whether we should send you in for a scan just to be sure it's not that. Yeah?
Yeah.
Any breathing difficulties, anything like that? There's a direct number now for suspected DVTs. They check you straight away. I think you might just go straight up there. How long has it been like that for?
About 2 or 3 weeks, and it's slowly getting worse and worse.
Hi, could I have the medical bed manager, please? Hi, it's Dr. Lee here, GP down at Farnham Road Surgery. We've got a 61-year-old gentleman with a left lower swollen leg. Do I just send him down there for after 10 or something? Cheers. Thank you. Bye-bye. Right, sir. You're going to A&E first with this piece of paper, which I'm just printing off, and then you'll go to somewhere called ambulatory care, who will, I suspect, scan you, examine you. I'm not sure it's a DVT. It doesn't clinically present as such. Usually they're hot and warm and a bit more tender, yeah? But there may be some underlying clot that's causing this, and give up smoking.
Yep.
It's a no-brainer.
Yeah, I know. Especially in my condition.
Yeah, I'm not saying that it's easy to do that, but it would be remiss of me not to say the obvious. OK? All right, cheers. Take it easy.
Thank you.
Bye-bye.
Bye-bye.
How are you?
I'm all right, good.
Yeah, we met a long time ago.
Yeah, about 4 months ago, wasn't it?
Yeah.
I've just come out of prison today.
Oh, I see.
So, I need my medical note
Yep.
to give to the council about housing.
Right.
And then I need to get some more tablets. They've only given me up to Friday from prison.
OK.
So I've been on 30 mil for the last 3 months, every day.
Of citalopram?
That's it, give me a C in it. Yeah.
This letter, where are you going to live now when you...
This is what I need this letter for, to get housed.
OK, so what did they say? They just released...
They said, they've released, they've released me and saying, basically, I've gone to probation, so I'll go back there tomorrow, but I've got my license agreement.
Right.
But now I need a letter from you to say what's my conditions, so I can show the council. So they said I should be able to stay in a hotel or a bed and breakfast tonight, and then they've got a place for me tomorrow, but as long as I've got all this paperwork.
In temporary accommodation, is it?
Yeah, no, this should be, temporary accommodation. Yeah.
So you've got depression. Is there any other active medical problems that you're worried about?
I've had 2 heart attacks, but that was through my misuse of drugs.
Right.
And sometimes I forget, and my memory is short memory getting bad. Long memory, okay.
Did you stop any warfarin or anything like that?
I can't remember. My memory's very bad at the moment.
No worries, darling.
It's been 2 weeks now, I'm off.
And do you think it's helped your memory?
It could be just mine, but it kind of little bit.
Better? OK.
I forget things so easily, losing memory day by day.
So you think your memory's getting a bit better now?
Yes.
Okay. They discharged you because they felt there wasn't any sign of anything like Alzheimer's or anything like that.
Has that been a progressive problem?
It's sort of lost all the time.
You've had a haircut, mate, have you?
Yeah.
Yes. Good on you. Come in. Come and take a seat over there, mate.
Thanks.
So I had a chat to you the other day because I got a letter from the speech therapist who were concerned a little bit about your memory.
Yeah.
And also a bit of tremor that you've got going on as well.
Yeah, no.
It's not much of a tremor, is it, really?
There's nothing there.
Occasionally people will talk about fasciculation, where the muscles will just be doing strange little movements like that, but Okay, I can't say anything. Do you think you're having problems with your memory?
Short term,
Yeah.
not all the time.
Yeah.
But, you know, I forget kids' names now and again. And
Yeah. Kids that you should know?
Well, my grandchildren.
Okay, fair enough. Do you ever walk into a room and suddenly think, what am I doing here?
Yes, it's happened once or twice, yeah.
Okay. What about things like leaving cooking things on and forgetting about them and that sort of thing? No, nothing like that. Okay. So what I'm going to do is there's a test that we can do that sort of tests for memory, yeah?
Yeah.
And I thought we might run through it and see what happens and see how it goes. So you happy for me to do that, yeah?
Yeah.
So the first bit is a bit of memory. First of all, you've got to imagine you're going shopping.
Yeah.
Okay? And I've got a list of grocery items. So tea, okay, cooking oil, eggs and soap. Can you repeat that back to me?
Tea, cooking oil, eggs, soap.
Okay, and do it again.
Tea, cooking oil, eggs, soap.
Good. Okay, so just keep that in your head. Okay. Right. So what I'm going to do now is ask you to point to different parts of the body for me. Okay. Yeah. Can you show me where your right foot is? Okay, your right foot, yes?
Yes.
Okay.
How's that side of things with the cocaine and?
Yeah, I've been clean and now I've got a year's drugs test with probation, and I'll be going to T2 again to engage with them.
Okay. Are you on any substitute?
No, it's just cocaine, isn't it? So
okay.
There's no substitute for cocaine.
No. I just wondered with the were you ever had any problems with heroin?
No.
Okay. So
I've been to rehab 3 times, and
So free of use for, I want to put this in the letter for them, for 8-9 months, is it?
What's this?
The no cocaine use?
3 months now.
3 months. Yeah. How long were you in prison for?
3 months. I'll come out today.
So you've got no pending issues now, court or anything? Okay.
So I've come to sort it all out, really. Because I've been on them tablets for 3 months, and they say it's not good to just come straight off them, is it?
No. Especially now you're out in the community, you'll need them as a way to probably help you. If you suddenly withdrew that, there's too much change in a short time.
Yeah, that's what I thought.
I looked at the heart and we've got no confirmed.
Remember, I was 25 when I had the heart attack. And then I had a mild one 2 years ago.
Because you're not under any cardiologist after that, right?
No.
Did you have an angiogram?
We'll start that thing up yet.
Yeah.
No, I discharged myself.
You never had a stent or bypass?
I didn't wait around long enough.
So it's unlikely we can... Because there's nowhere on your record it says that. But it might be that they suspected you had chest pain and they did all the tests to check. But not everyone who has chest pain has a confirmed ischemic heart disease. You would be in a lot of medications. That's what I was surprised when you said you had a heart attack. Your prescription is here for this Talipam.
All right, then.
Okay?
Right, thank
Good. Good luck with the housing, okay? If you run into trouble with that, come back to us tomorrow. But you've got some family support. Worst case, is it? Your sister?
Yeah, I'll stay somewhere tonight.
Okay. All right. See you.
Thank you very much.
Bye-bye.
Okay, your right foot, yes?
Yes.
Okay.
Oh, no.
No. Show me your left hand.
Right.
Okay. Okay, so I want you to tell me the names of as many animals as you can.
Aardvark, kangaroo, rabbit, cat, dog, mouse, cow.
That'll do. Good. You have to get to weight. You've done it. Can you remember those things that I told you before?
Tea. No, I can't. I've forgotten about them.
Okay, so that's fine. Okay, so in fact, you've got a pretty good score at it, mate. So I'm reasonably happy with this. It's pretty accurate, this thing that tells us, if people, we're looking at dementia and that sort of thing. So
Yeah.
I'm not worried that you have that.
Good.
So I'm pleased.
Yeah.
From a dementia point of view, you're not anywhere near that.
That's good to know.
What about your medication now? How are you getting on with it?
I haven't got any. I'm out at the moment.
It's been done 2 days ago. I mean, we've signed it. So go and see if those medications are done next door, and I'll give you this other little 10 milligram to go with the 20-year-old. Yeah.
Right. Thanks a lot.
Okay, mate. You take care and...
Thanks a lot. Thanks a lot.
See you, mate. Bye-bye.
Bye-bye.
Bye.
How did he do?
Oh, he's had a stroke, so...
Yeah.
And actually, he's done remarkably well since then.
Yeah.
But he's frustrated because he wants to get out and do things. And on that, he did pretty well. You know, he got something like 26 out of 30, so I'm quite happy about that.
Hello, you gonna give us a smile? Oh, she just gave you a real look there, Emma. Give me 5. Give 5. Good girl. Another one? Yeah.
Let's book from 10 to 9.
Oh, you want another one before we go? Good girl.
Thank you so much. Thank you. Bye-bye.
How can I help?
You can see by it's just his rash.
Yeah.
It's completely covered all over his body.
Mm-hmm.
He's been taking Piriton.
Mm-hmm.
But he keeps sticking it up. I don't think he likes it.
Is he any discomfort with it?
No, it's not itchy.
No? Okay, so he's quite comfortable in himself?
Yeah, he seems all right, yeah. I'm just feeling itchy looking at him, that's all.
Completely.
Yeah.
And is there anything that he has that makes this worse?
It's only because he started crawling, whether he's getting around in carpet or something, I'm not sure.
Mm. So can you just undo his dungarees so we can have a look? Oh, I'm sorry. Okay. And you've not changed your washing powder or soap or anything like that recently? So, let's lift you up. Can you just grab his back? Just have a look at that. Okay. Okay. Normally what we'd use is a mild steroid cream just to settle it down, but it's not really going to help us find out the cause of it. So considering he's so young, I think it'd be worth getting paediatricians to have a look at him to see what they think, to see if they want to carry out any sort of testing. Because he's been weaning onto solids. Is this a food-related allergy? Is it something else?
So just carry on taking the Piriton?
Carry on taking the Piriton, that's not going to do him any harm, and hopefully eventually it will start to take effect. Anything that you think's making it worse, obviously just try and avoid and keep a note of, okay?
She reckons it's me. I don't think it's allergic to me.
Well, I don't think it would take 6 months for it to show.
Yes, that's what I thought. Okay then.
Okay.
All right, thank you, doctor.
All right, no problem.
Thank you so much.
Don't forget his tummy.
Oh, yeah.
Okay.
Who are you seeing, sweetheart? Do you know?
Mushy.
Mushy.
Mushy? What is it Mushy? What's his name then? I don't know when she gave me the appointment. Was it Mushy?
Mushy?
What's his name
What
then?
is it? Ready? It's Moyes, Dr. Moyes.
Dr. Moyes.
Oh, it's like Mushy.
It is like Mushy.
Upstairs, downstairs?
You like down?
She's upstairs.
Upstairs. Go then.
Yep.
Very much.
It's Dr. Hyder. Come and have a seat. I think I've spoken to you on the phone, haven't I? Oh, were you with someone else before? Not sure. Oh, OK. So I've been getting a lot of letters about you. And
You have?
Yes, I have. Because you're going through some uncertainty with what's happening at the moment with your ferritin levels. Has that been confirmed then?
Yeah, they said it was.
Still's disease is very rare, and Timer is the only case I've seen with this condition. It's a type of inflammatory arthritis, a little bit like rheumatoid arthritis. The classic symptoms are a distinctive bumpy rash, high fevers, and joint aches and pains.
When it got really bad, because I had it for a year now in July, but it got really bad in November. When I went in, they had Still disease on the system, but they didn't say, they said that we can't diagnose you with that because there's still a few things that's uncertain. I was tested for so much stuff.
Yeah. The diagnosis of Still's disease takes a little longer than more common diagnoses because other things need to be excluded first as it's so rare. Initially, treatment for Still's disease is with high-dose steroids to reduce inflammation. And when's your next appointment? It's coming up quite soon, isn't it?
I think it is like next week or something, but I've got one at the Royal Free Hospital next week as well.
Okay, are they a specialist centre for Still's disease, or what was the reason?
They referred me to them. I have to send bloods every month.
Right.
But
More of a specialist unit for that area, maybe. Okay, that's fine. So that's your Cetraban and the calcium and vitamin D together.
Yeah.
The long-term prognosis is variable. Some patients have a few episodes at the time of their diagnosis. Some people may be affected in the long term with symptoms of arthralgia, and it can also affect their lungs, liver and spleen. So if anything changes, I mean, they're quite good because I have been getting their letters regularly, but if anything changes and you find out before we get the letter, you can just phone in and let us know what's happening.
That's fine, thank you.
Okay.
Yeah, thank
All
you.
right.
It's Dr. Hyder, right?
Yes, that's right, Dr. Hyder.
All right then, thank you.
Take care
Nice
then.
to meet
You
as
too.
well.
Bye-bye.
All right, bye-bye.
Oh, let me have a look.
I've got no idea what that is. I don't know. I think it's one of those things that you use on gladiators. Are you ready? Yes, please.
How can I help?
In all fairness, I don't think you can do anything.
Okay. That's
I-
really
I guess-
reassuring. Oh my goodness. Okay.
See what? Look, I've got cracks everywhere.
Yeah.
Cracked open all round the back here. Look, it all splits as I walk. And now I've got this all come up. Now, can you believe 2 weeks ago I had the chiropodist. She shaved everything down to a baby's bum. And that's 2 weeks.
Wow.
And it builds up so thick between the toes. It's like Kermit. It's like a frog. You know, I've got thick skin between, so I can't move my toes. I know it's horrendous. I had to live, but it's...
Sorry, I'm not laughing. I'm
I
laughing
know,
at the
no, I
level of detail
understand.
you're sharing with me. That's it's great.
No, I understand. I mean, I've lived with it for a lot, but it's just getting worse. The itching is unbearable. I could literally throw myself off the balcony. I don't know what to do with myself.
I am concerned about this.
Yeah, it's very painful. Last night, my foot was all puffed up here. I mean, it was so... And it was absolutely red, and this was all mauve. You know, really mauve, and I couldn't touch it.
You're not having any temperatures, are you?
No.
All right, so we need to give you some antibiotics for that.
Just for that, yeah.
Okay.
The other thing is frightening, actually, very scary. For the last 3 or 4 weeks, I've had the room spinning round.
Right, okay.
And, well, and it's horrible because you can't stand up. I can't, if I move my head, it goes flying round. I get ringing in the ears.
Does this only happen when you move your head?
Seems, well, I wouldn't say it's only when I move my head, but it's some natural sort of weird feeling.
Any problems with your speech?
Speech?
Yeah.
Oh, well, do you think I've had a stroke?
I'm going on holiday soon.
Where are you going?
I don't know what it's called yet.
Spain.
Spain. Very nice.
Going to Camber Sands, and apparently you can't go in the sea there because somebody got killed with jellyfish.
I also read that you've got every chance for a shark attack.
No, really? Brilliant.
I was in the Navy. My daughter once said to me, "Where have you been, Dad?" Got all the way around places I'd been.
Yeah.
And she said, "Have you been to the Isle of Wight?"
I've come back from holiday at Hulkaduki.
Whereabouts in Greece is that?
It's like three.
Mainland Greece.
Oh,
but
the
on
three
side,
fingers?
Three fingers, yeah. One of those.
Yeah, no, I've been down on one of those fingers, but I can't remember that name, but anyhow.
It's nice to see you. Thanks for coming. How are you?
A couple of things, oh, beauty. I'd like to know, am I fit for travel? I know, I think I'm fit for travel. You know, because I've got friends in Ireland and all that, you see.
So you're going to Ireland? Is that, and how are you going to get there?
Well, it can be a car ride, or they'll take me over, or a plane.
Okay.
I'm walking reasonably well.
Yeah.
A little bit, you know, wobbly like, but I'm doing my own cooking, my own gardening even.
Yeah. Brindley's recently been in hospital with a condition called delirium, or sometimes known as an acute confusional state, which was due to a urinary tract infection in his case. The symptoms of delirium are behaving unusually or irrationally, having short-term memory loss, having problems with speech, or being disorientated.
I'm quite happy for you to travel. Going by, I mean, Ireland's quite a long way by car, so it'll be tiring for you. The plane is obviously much quicker. I would just suggest let the airport know and have someone take you in a wheelchair to and from. It can be quite long distances.
Yeah. Oh, that's the second thing I was going to ask anyway. I was a rep all my life, like the rep on the road. Now, I have driven, but not anywhere special. But I feel good with it.
Do you feel comfortable and confident about driving?
I feel comfortable and more comfortable driving than I do walking.
Right, OK. I would say looking at your overall health and your overall mobility and your overall speed of reaction, I would be concerned about your driving, and I would say give serious consideration to sitting back and being chauffeured everywhere.
Driving's in my blood, if that's all I can put it. Like, you know, I've driven all my life. Yeah. Like, you know, being on my own in a house, I've got to get up to the shops.
Yes.
I mean, I can't walk all that far.
I understand the freedom and the mobility that having a car gives you, certainly. And the last thing I want to do is to take that away from you. But I need to give you my honest view.
Yes.
You know, and I've got concerns, and it's not because of your age. You know, it's just because of your general overall health.
Yeah,
you know, and I wonder about, because driving is a really complex task that we have to do. It involves lots of different things.
I've had the pleasure of knowing Brinley for 17 years since I started as a GP in Slough. So I've seen Brinley retire and enjoy his retirement, and I like to think we have a really good, friendly relationship. My concerns about Brinley's ongoing ability to drive is related to his mobility and the speed of his reflexes. So even though mentally I think he can see the dangers and what he needs to do, I'm concerned that his body couldn't respond quickly enough to take action that he might need to do.
And I hope you don't mind me bothering you.
No, I hate to be bothered. Yeah. OK, right, OK, nice to see you. OK, nice to see you, take care.
I understand you've got CCTV out there. I had my car, I've had my handbag that's stolen out of my car. My mobile phone's in my bag. Why did I take it out? Okay, don't worry. My bank cards, everything's in there.
What was the door open?
No, my bloody window was down. I don't know how. I must have been.
Is this blue one yours?
No.
Oh.
Where that car just driving out, it's just there.
Take a breath. Have a sip of water. Okay.
Any problems with your speech?
Speech?
Yeah.
Oh, what, do you think I've had a stroke or something?
No, I'm just need to rule out things. All right, we're gonna have to check you over. Okay, that's better.
What's it like?
It's good. Let's just have a look in your ears. Okay. Okay, wait, I'm not done with you yet. Okay, follow my finger with your eyes. Hands out in front of you. Okay, just raise your right leg off the floor.
Oh, God, now you're talking.
Some difficulty in balancing?
I do fall over sometimes.
Okay, have a sit down. I won't make you do any more.
Oh, God, I'm sorry, darling.
I think you've got something called benign positional paroxysmal vertigo, BPPV. What this condition is, it's what you're telling me. So when you move your head, you get the sensation of the room spinning around you. So basically, inside your inner ear, you've got these very fine hairs, and on these hairs lie some crystals, okay? And they help regulate part of the balance system. Sometimes, for some reason that's unexplained, these crystals become dislodged. Often this will settle, the crystals just automatically align, and you're back to normal. So it can just be about a little time. If it's going on for too long and it's really disturbing, we can try different manoeuvres, different techniques to try and get your head in different positions to realign the crystals.
Yeah, it's so scary, you know, it really is. And when you're living alone and everything, you think, oh my God,
you don't drive, do you?
Pardon?
You don't drive?
No, thank God.
Okay.
That'd be a menace.
So let's see how it gets on. If it hasn't settled by the time you come see Dr. E, we may need to try this manoeuvre, okay?
All right, darling.
All right?
I'm sorry to have taken so much of your time.
That's okay.
I'm sorry I talked too much. I'm sorry.
That's okay too.
I haven't wasted your time, have I?
You will never waste any of our time. Please
No, I
don't
do.
say that.
I worry about. I know how busy wasting your time, really.
Well, it's not a waste of time if you've got a problem. Take care. Bye-bye.
I need to cancel my bank cards and everything. I don't have it. They have my mobile number. I do, but I don't know what it is. Yeah, it's just that that couple, they just look really suspect. I've gone in there and because they were rummaging around and then they just walked off. They knew I was distressed. And then I shouted after them and they just stopped and they looked around and said, what? And I said, did you see? I don't know, it could be in the boot. That's fine, that's fine. Hello?
Nini Matu. Come on in. Hi. Come on, have a seat. How can I help?
Oh, yeah. I met Dr. Jamil about 2 weeks back.
Yes.
And my thrush in the vagina has not gone away.
Right.
When I stop using the thrush cream, it comes back. I thought for 1 week, and I did, there was irritation all around and penetration and any, sex was very difficult for me.
Right.
And I have to change 2-3 underwears in a day because it's, I keep cleaning it up and...
So she did a swab, which was okay, wasn't it?
So what was a swab?
The swab's normal.
Yeah.
Okay. You had an ultrasound scan as well, didn't you?
Yeah, that's true. Yeah, but she wanted to see whether there is some kind of a liquid around in the area. I had a hysterectomy.
What symptoms have you got? What does it feel like?
It's just like the secretion, and it's like a white discharge, quite watery. It is not jelly type, but it's more watery, but white.
Can I have a quick look?
Yes, please.
And any problems with your waterworks or anything like that? Passing urine? No?
No, not at all.
Get yourself dressed again, yeah? That's fine. It all looks pretty good there. I think it might be a bit of estrogen deficiency. Have a seat there. Oh, really? So I think we can probably make you feel more comfortable with some vaginal estrogen tablets. Estrogen deficiency most commonly occurs at the time of menopause. It occurs because the ovaries start to fail to respond to the hormone, which is encouraging ovulation. Ladies experience a range of symptoms, most commonly hot flushes and poor sleep, anxiety sometimes, and vaginal dryness and urinary symptoms.
I mean, you have to insert it.
You just put them high into the vagina at night time.
But being diabetic...
That's fine.
That's fine.
That's absolutely fine. Not very much is absorbed into the system. The tablets just work where they're inserted, so in the vaginal area, and they have quite a positive effect on the bladder as well. So I think that will make you feel a lot more comfortable.
My bladder leak.
Really?
Sometimes,
I think this might be the thing
when I
then.
cough or sneeze or something.
I think it might help that too. Will you come back and have a review when you've run out of them?
Yeah, sure.
Okay. I think that will help quite a lot.
Thank you very much.
Thank you.
I did 8 miles this morning without stopping. God.
Oh, Nick.
I look like I've been in a shower. And when I was running, there was this man in the tightest lycra bodysuit I've ever seen. I saw everything. But he was a runner.
Was it like a bag of Brussels sprouts?
Yeah, he was a runner. Yeah, well, I've got a bag of oranges there, to be honest.
While he was running?
But he stopped and he was clapping me and he was going, go on, you can do it. So I was running.
I'd say I would have done it quicker if you weren't wearing them.
I was like, oh. Hello, Leslie. In you come. So this is to check your blood pressure, because we increased your irbesartan back up, didn't we? Because your kidneys were back to normal.
What did they say you've got? What's your diagnosis?
Avian lung disease, so hypertension,
pneumonitis.
Hypersensitive to birds.
They told me to get rid of my birds because I had about nearly 500 different types of birds. I went over to a friend of mine this weekend, and she suffers with similar to me. She gives births and all that. And she had...
A nebulizer?
No, one of these.
Well, it's similar, isn't it? It does the same thing.
Ionizers with salt.
No, that... Oh, right, so that's just steam for your lungs, really, yeah?
While I was there for 3 or 4 hours,
It helped.
it helped the breathing.
A nebulizer has drugs in it. Yeah, the ionizers are just
water.
Can I just...
Sorry,
Could you ask me to come?
Yeah, please.
What Les is saying is that when he tries to take his Ventolin or whatever, he can't suck it in.
Well, just can't suck.
Let's see if we can get the nurse to have a look at you and see, yeah? You don't have a nebulizer at home, though, do you? You've always had your medications through inhalers, yeah?
But they're quite easy, aren't they? Because you can just put the mask on and it comes out in a mist.
No, it's OK. We're going to talk to the respiratory nurse about having a look at you. Now, she certainly should be able to do that sooner rather than later, yeah?
It's getting terrible, doctor. The night I can't sleep. Oh, no.
Yeah, you've given him those 2 sleeping tablets.
I haven't put him on
Or
2
you
sleeping
increase-
tablets. It's an antidepressant.
Antidepressants, right, so it's not a
Side
sleeping
effect is that sometimes it makes you sleepy, but that's not what it
it's
is.
Not doing
It's an
that.
antidepressant.
It's not making him sleep, and that's what's frustrating him. He's not getting any sleep.
You know that it's difficult to give you straightforward sleeping tablets with your lung problems, yeah? Are you any less anxious than you were?
Is it?
Tissue, Leslie. What is it that you're scared of?
I can't breathe. I can't breathe.
He keeps coming up with this massive red thing on his face.
So what that would suggest to us...
It's an allergic reaction.
It is, yes.
My poor baby.
I seem to be allergic to everything. Tomatoes, vinegar, oranges, citrus fruit, strawberries.
What about nuts?
I haven't tried them.
He's got all these lumps and bumps come up on his hands.
It looks like an allergic type reaction, like a heat rash, but it's not quite a heat rash.
I'm allergic to hay fever.
Are you taking anything?
Not for the hay fever.
Bit of a rash.
Okay, I have those strawberry allergies. You're also not the first person this morning who might have had a strawberry, who's eaten strawberries and come out in a rash. That's why it's in my mind.
Leslie, sweetheart, I need you to breathe, yeah?
Sorry.
So you don't feel like you're getting the Ventolin in because you're struggling to take it, yeah? Take your time and come back across, Leslie.
See, the thing is, you need to say to her what you're frightened of, because you're not frightened. Yeah, but you're not actually frightened of dying, are you?
I get up in the middle of the night.
Yeah, but you're not frightened of dying.
No,
so
I'm
what are
afraid
you frightened of?
I'm afraid I can't breathe.
Right. There's a nurse around this afternoon who can do your nebulizer. Let's see how your breathing is after that.
The other thing is, I say, I wake up in the middle of the night and I cannot breathe at all.
Right.
I don't know whether to phone the ambulance, wake my brother up and go to A&E.
Right, OK. I think if you're that worried that you can't breathe, you call an ambulance.
That's what I said
Nothing
to him.
else that any of us can advise you, because we're not there with you.
No.
Yeah? If you can use your inhaler, that's what you should try first. But if you can't, then what we need you to do is we need you to call an ambulance to get some help.
Well, he sat out there just a minute ago, and I said, what are you frightened of? I said, because you actually say that you're not frightened to death, and he's not. But he just doesn't like that feeling of not being able to breathe,
yeah.
which is fair enough. But, I mean, then he gets depressed and says he'd just take a load of tablets.
I've taken gabapentin.
You've taken an overdose, Leslie?
No. Well, he takes loads of tablets, more than he should.
He's the pain.
OK, Leslie, I think you're getting into a real muddle, and I think you're taking things that aren't the right things for your condition.
I end up in pain.
You were in hospital with your heart, yeah? And they did all of the tests, and they're seeing you again in outpatients, and you're having your pacemaker done. We need to get you so that you're using the right things, yeah? So when you're breathless, when you're wheezy, you need to be using your inhalers if possible. when the gabapentin you just take as a daily dose, like you take your blood pressure tablets. You don't munch extra blood pressure tablets, you don't munch extra gabapentin, yeah? You take them as it says on the box. Yeah? Let's try you on an inhaler now.
Sorry,
the nurse will be
doctor.
waiting for us.
Sorry, I apologise.
Don't be silly.
He can't get up to bed, so he's sleeping on the floor. And then he's so big, he can't turn over properly. See how you feel? You might feel better on this. You might get in a little bit.
Have a seat. Sheila will come back when she's free and do the nebulizer. And then I'll see you when you've had that done, OK?
Is Mum at work today?
Mum's travelled.
So you're having daddy-son time together?
Oh, of course. Yeah, when we get home, you can have a biscuit. So if you win the pot for Daddy, I'll give you what you want. Is there anything else you want to say to the doctor?
Yeah.
Are you sure?
Yeah.
That's good. I like your smile.
Very pretty smile.
You ready, Daddy?
Yeah.
Okay. You okay?
Yeah, I'm fine.
Hello.
Yeah.
Hello.
Hi.
So little one's here for her first injections. Okay, so it's 3 injections today. So it's this one, diphtheria, tetanus, pertussis, polio, all combined there. This one's for pneumonia, and then one for meningitis B. Okay. And then this one is medicine that goes in the mouth. Okay. So Mum didn't want to come in then, she's left you. Sometimes mums get a bit upset, don't they? Yeah, right there. Pull that out for you. Right, so if you just sit back over here and just hold her as you... Bring baby with you. Oh, bless. Just... Oh. Okay, so she will cry, okay? Oh, no, I'm sorry. Oh, no. That's it. Fine, give her a nice cuddle. She's fine.
No. You made me cry.
That's why Mum sent you in. It's not...
baby. What did they do to you? Did it make you feel bad?
Well, it used to, yes, I'm sorry, but yeah, you've got to kind of think it's for their own good in the long run, isn't it? So, yeah, so, no, I don't feel bad anymore. Okay, so just carry everything as normal, but just give us some regular Calpol, all right? Okay. All right, then, take care. Keep her nice and cool, that's a good idea. Okay, bye-bye. Bye. They never stab him, my baby.
Okay, lovely.
Okay, thank you. All right.
All the best.
Thank you.
Yeah. Bye. Bye, Olivia. Bye-bye.
Okay, lovely. Thank you very much. Take care. Thank you. Bye.
See you soon. Have a nice evening.